from the News Channel 5 Network. This is Pasa Nashville.
Bienvenidos and welcome to Pasa Nashville. My name is Christina Allen and thank you for joining me. I'm excited to introduce you to two friends of mine. From Siloam Health, we have Katie Richards, who's the Chief Development Officer, and Cap Soom, is it Soom?
Soom, yes.
Who's a Patient Relations Manager. Thank you both for being on the show.
No, thank you for having us, Christina.
I'm excited to share. I've had a representative of Siloam years ago, but you guys have done so much. So, Katie, kind of give me an idea. What is Siloam Health and why is it significant in the impact it makes on our community?
Yeah, so Siloam Health is a healthcare organization. We do medical care, community health, and student education. We are primarily a primary care clinic. We serve around 4,000 people a year. 90% of those that we serve are foreign born.
Wow.
Yeah, so they come from over 80 countries and speak over 70 languages.
And how did you get founded? Because, I mean, with Nashville becoming such a place to be for our refugees and immigrants, why was that important when y'all founded?
Well, what's interesting is that it wasn't part of our plan when we started. So Dr. David Gregory was sitting in church one Sunday, not listening to a sermon, passing notes and dreaming of what it would look like to care for people in the Edgehill community. And so when we opened, we saw predominantly folks from the Edgehill community. And a couple years in, the Vietnamese community showed up. And then over the 90s, when Nashville grew so much more diverse, Siloam grew diverse. So it wasn't part of our master plan, but as we have remained open-handed, it's who the Lord has brought us.
And you're Christian-based?
We are.
But you serve every faith?
Yes, all walks of faith or none are represented in our patients.
And Kapsum, I love your story.
Thank you.
And I would love for you to, you came as an immigrant, and can you tell your story, how your involvement with Siloam grew from maybe a patient to a volunteer to now a member of the staff?
So my family came to Nashville, United States back in 2001. Before then, my dad was here by himself, and when my family joined my dad here, our family is uninsured, and I was uninsured as well. So I needed health care, and to get started back in school, I need to do all the immunization and physical and stuff. So Siloam was there for me, and I was a patient for a while, and then I went back to Siloam when I was in college at Belmont. They needed volunteers who speak my language. I speak Zomi, from ethnic language from Burma. And so I volunteer there, and after a while they have an opening and I really wanted to join them. So that's how I became.
That's exciting. So what brought you, did you come as a refugee, as an immigrant? How did you come?
I came as an immigrant. So my dad came here first and brought the whole family over, yes.
And I understand you are a U.S. citizen.
Yes, now.
Was that a long process or was that a easy process?
It's about 5 years or so process, so there's a wait there.
Yeah. But you took it through the proper channels to do so, and that allowed you. So when we talk about someone from Burma, which we have a big population here, how many think you are here from?
So when we first came here, there were only like 3 families from Burma, and now there are, I would say, about 10,000 of us now with different ethnic groups.
And I don't think people realize that.
Yeah.
And I think with Siloam, as you were saying, 90% are from foreign born. I mean, you know, what are your top languages spoken?
So Spanish and Arabic are our top languages, and then the rest of them are from Nepali to Burmese to Zomi and different
And they're just,
ethnic.
it goes down.
Go down.
And I know we talk about this with our metro schools. It's reflective of our metro schools children.
Exactly.
So how does Siloam get the health, the medical staff that might not speak the language? Is it all through translators, or do you have just a very diverse staff that reflects the community you serve?
So we certainly have a diverse staff. There's over a dozen nationalities represented on our staff of 45. And many of our clinicians who are American born also are bilingual as well. But of course, we can't satisfy all 70 of those languages on our staff team. So Vanderbilt is a great partner of ours. And we use their language line, which is an international service through AT&T. And in turn, we train their students when they rotate through Siloam on how to use the language line.
And is the language line with medical expertise in the language you need. Is that correct?
Yeah, Capsum actually knows a little bit more
Yeah.
about it than I do.
So there are specifically medical interpreters, and we also have volunteer interpreters, such as myself, who sometimes it's hard to find them on the language line itself. So we have more indigenous languages.
Right.
So
So as becoming the 90% of the people you serve are foreign born, how do they know about you? Is it word of mouth? Is it going into the congregations? Because it is a very hard group to reach.
word of mouth is our number one way of reaching our patients right now, and family who knows families and friends. Yeah.
So do you feel like you have captured, because once they come in, do they get screened? Or wait, are you a state? Are you funded? Is it federal funding or state funding to have the
Refugee program?
Yeah. The refugee medical screening program, which is separate, really from our primary care clinic, it's federally something that we oversee actually for the state.
That's what I thought. So anyone coming into the state from as an immigrant will have to be screened to
As a refugee.
As a refugee, and like basic, shots, measles,
Exactly.
or whatever the top issues are, just so that they can go back. But how long can they continue to be with you without? Do they have a certain time frame that before they have as a newly arrival?
Yeah, often they have an 8 months insurance that is temporary insurance, refugee insurance called PCU. And some of those refugees have children and have young kids, and they're eligible for teen care. So if they are eligible for teen care, after we have given them their initial screening, they'll transition to different teen care providers. And then, but the rest of them who are single and doesn't have any insurance, they have PCU for 8 months. And after that 8 months, if they're still, some of them have jobs, and the job, through job they have different insurance, and then we can help them transition. But a lot of them does not have any insurance after that, so they stick around with us.
And are they aware of pre-health opportunities?
Preventive health? Yes,
preventive health.
they are.
I mean, do they are? Because it's it's hard to reach them from pregnancy to just being proactive and being preventive.
Yeah, that's one of our big part of patient education that my team specifically try to reach is preventive care.
And that's really what we're doing with our community health efforts. So partnering with the Burmese, Bhutanese, Egyptian, and Hispanic communities to send community health workers from those communities out into those communities, to answer those questions and bring that education. Yeah, well, we have some amazing community health workers that have grown up in those cultures, and what we do is a mix of, we listen to the felt needs of that community. So what's happening that you guys are feeling a lack in knowledge, or maybe there's issues with dental, whatever that is. And then we also do assessments to get actual needs, and we just do a lot of conversation and learning and listening and understanding to help bring that health education.
So where does mental health come into this? Because I would think that in itself is stressful.
Yes, so we practice whole person care. When we practice healthcare at Siloam. So we have a behavioral health consultant who's on staff, we have a pastor who's on staff, and more than that, our clinicians look at patients as whole people, just like we feel like Christ looks at us. So our clinicians are asking our patients, how are you doing emotionally, and how are you doing mentally? Because we're not funded through insurance reimbursement. We keep our doors open because people give in the community. We have the luxury of sitting with our patients, looking them in the eye, hearing their stories, and treating them in that way.
So as a patient, newly arrival, you come, did you know English at all at the time?
No, not me.
So now you learned English, college educated. Can they relate to you when you go talk to our community because you've been through it? Do they respond to you better than the average person coming?
I would say me and also my team, my team specifically is all foreign born as well. So I think we're able to hear their story and connect with them, and able to, help them with the needs that is a little bit more unique than, someone who is native to here. So yes.
I think that's amazing. Okay, we're going to take a quick break, and we're going to come back and talk about the Siloam Health and their new Amplify Nashville, their amazing event that's been going on, and join us right back at Pasa Nashville.